Hey guys, what's up? In this video, we are going to be doing Digitalis. The common name is foxglove and the family is Clofuriaceae. Before starting the drug, I would like to tell you that I have done a review video on Digitalis across the system. You can check on the I button if you haven't seen that video yet. The first thing that we start in Digitalis is ailments from. Now this is what has been asked usually in the vivas as well. The ailments from in Digitalis is high living, alcohol, tobacco, excess sexual intercourse and after fever. When they say after fever, and you also have to remember that Digitalis is a cardiac remedy, you can correlate it with rheumatic heart disease as well. Okay, then we move on to the constitution. The constitution is general. The words they've used is like a female, and we'll give her some hair. The hair are usually brown in color, and then we have blueness around the cheeks, we have blueness of lips or distended veins, and we have blueness around eyelids. Okay, the lids are closed. Please try to imagine this as a girl. And there is also a tinge of redness around the cheek. So this is the constitution or appearance. The most important words that they have used is death-like appearance. And then there is blueness or distended veins in eyelids, cheeks, lips. It's also around the tongue. These all things you have to remember and also understand that it could be a consequence of cyanosis. Okay, so now since there is death-like pallor or appearance, the commonest mental thing which you can think of is the person would be fearful and anxious. Okay, we will add on more mental symptoms here as we go ahead. Okay, now continuing with the main aspect of the drug, which is the heart symptoms. Now the one thing about Digitalis is that whatever I have noticed is Digitalis is used in literally all heart conditions. Here's a totally inaccurate representation, but you get my point. So this is the heart. The characteristic symptom that is there in Digitalis is, let's say this is a cross wire, okay, and the patient feels that the heart would stop beating, and let me remind you, this is the most important symptom if she moved. Okay, so these are like the danger valves. If you touch them, then you're dead, like that. This is opposite of gelsemium. The heart would stop beating if she moved. Now if you are talking about pathologies that could be related to Digitalis, then we have a big list, starting from cardiac failure, cardiac dropsy, then valvular complications are mentioned in boric, but in Allen's they say without valvular complications. There is hypertrophy and dilation. So now as a consequence of dilation and hypertrophy, the lungs feel squeezed or they're unable to expand. Then other things which we have is pericarditis, and the most important thing is atrial fibrillation or auricular fibrillation. This is the most important symptom along with arrhythmias. Now these two symptoms will help us determine the pulse of Digitalis, which is again a very characteristic thing that you have to remember. It is slow, irregular, intermittent, and intermits at every 3rd, 5th and 7th beat. Again, the most important thing, intermits at every 3rd, 5th and 7th. This can definitely be asked in Viva as well as for 2-mark questions. Okay, now let us try to understand little bit about pathology. if you will. How it happens in circulation is from body, it goes to SVC or IVC, then right side of heart, then lungs, then left side of heart, and then again to the body. This is the normal circulation, right? So in case if there is right heart issues, there is going to be backflow to the body. Most important organ affected is liver. So I'll draw liver here. If there is left-sided issue, there is going to be backflow and it is going to go to lungs. So here we talk about lungs. First, let us start with lungs because it is more easy to understand. The commonest symptom that happens is pulmonary edema due to backflow. Now, pulmonary edema has a certain common symptom, one of which is cough. Cough here is bloody. And there is the whole concept or lung problem is because of myocardial dysfunction or failure. There is desire to take deep breaths, and respiration is irregular, difficult, and deep plus involuntary sighing. Now, involuntary sighing is seen in one more remedy. The name starts with I. I want you to comment down below which the remedy is. Now, this was about the left side. Now, let's see about the right side. Because the drug mentions that the complaints of liver are associated with heart, so it is safe to assume that it could be because of right ventricular failure. There is sore, enlarged liver, and it also has jaundice symptoms. Okay. Now the characteristic here in this drug which you should remember and which is not seen a lot is the stools. The stools are pipe stem like, very light, also jaundice, ashy colored, and involuntary. Okay, so now since we are at this pipe stem shape, there is one more interesting thing which you should remember is this. This I've drawn is a straw. In the bladder, okay, there is a sensation, pain, as if a straw is thrust back and forth at the neck of bladder. Okay, this is so painful even to imagine. This is the urinary symptom. Along with that, because heart, urine, everything is related, you must have seen the video on eposinum. If not, then you can click on the I button. There is suppression of urine in Digitalis. So this is the right ventricular failure. Along with that, you also know anatomy wise that if the right atrium enlarges, there is going to be pressure symptom on esophagus. Also, if you see here, there is difficulty with motion. The person in general wants to stay still. So there is discomfort even from slight food. Thoda bhi nahi chalta hai. Because the commonest thing that happens is dysphagia because of right atrium enlargement. Not just slight food intake but also from sight of food. Okay. While we are at it, there are many GI symptoms as well. So there is faintness and vomiting. There is constant nausea which is not better by vomiting, and there is salivation, excessive salivation. So these are some words that you can remember to add on. Now coming to modalities, there is this one peculiar modality that the person has aggravation from sitting erect. There's one more symptom that is mentioned, that fatal syncope may occur if the person is made to stand in upright position. So sitting erect or standing upright position is an aggravation. Also, second aggravation is after meals, keeping this symptom in mind. So amelioration will be empty stomach, and amelioration is in open air. So this is Digitalis for you people. I will be attaching the note at the end of this. If you've liked the video, then please like, share and subscribe to the channel and comment down your views below. I am going to try to do a cardiac series right after this. Thank you for watching the video and all the best.